Good morning once again, and it's a real pleasure to have you all. The theme of today's webinar is investing in occupational safety and health in the face of COVID-19 for a sustainable geothermal industry. I am very pleased today that we are joined, and I wish to welcome as well, by the Cabinet Secretary for Labor and Social Protection, Honorable Simon Chelugui, the Principal Secretary at the Ministry of Labor, Engineer Peter Tum, the EACOSH Occupational Safety and Health Secretary at the Directorate of Occupational Safety and Health Services, Dr. Nyandusi, the Director of DOSH, Dr. Andrew Muruka, the MD and CEO of the Geothermal Development Company, Engineer Jared Otieno. We are also joined by Dr. Onacha from Akira Geothermal, who will also be one of our panelists, and by a host of specialists in the geothermal industry, practitioners in occupational safety and health, public and private sector players, as well as international participants. I wish once again to welcome you all. The objective of the East Africa Conference on Occupational Safety and Health today is specifically providing a platform for deliberations on policies and leading practices in regards to occupational safety and health in the geothermal sector towards, and this is most important, a vision of zero accidents. Ladies and gentlemen, our program is going to run for about 2 hours. We will start with welcoming remarks from the Vice Chairman of the Geothermal Association of Kenya, Bwana Paul Gogi. Paul, I will request you to now proceed with your opening remarks. Welcome. Excuse me, sir. If I could kindly request you to unmute your microphone. Please proceed.
Thank you, Bwana Moderator, the Cabinet Secretary, Minister of Labor and Social Protection, Honorable Simon Chelugui, our dear PS, the Managing Director, Geothermal Development Company, who is supposed to be in attendance but has been called in another meeting. The Secretary of Occupations, Safety, Health, and Dr. Musa Nyandusi, the Director of Occupational Health and Safety, DOSH, Dr. Andrew Muruka, the Director of Geothermal Resource Development, Akira Geothermal Limited, Dr. Stephen Onacha, members of GAK Board of Directors, Managing Director, KIPI Africa, members of GAK, distinguished guests, ladies and gentlemen. Good morning. On behalf of the members of Geothermal Association of Kenya, GAK Board of Directors, and KIPI Africa Limited, I would like to warmly welcome you to attend today's forum on occupational safety and health in the geothermal sector. I would firstly like to take this opportunity to express our sincere thanks to our guests for participating in this important forum. I wish to categorically recognize the presence of the Cabinet Secretary, Ministry of Labor and Social Protection, Honorable Simon Chelugui, who is the chief guest in our forum today. I also wish to recognize the presence of the Managing Director, Chief Executive Officers, Geothermal Development Company, who should be joining in the event he becomes free. We are also honored to have in our midst the Secretary of Occupation, Health and Safety, Dr. Musa Nyandusi, and the Directorate of Occupation, Health and Safety, DOSH, Dr. Andrew Muruka. Finally, we wish to recognize the presence of the Director, Geothermal Resource Development at Kira Geothermal Limited, Dr. Stephen Onacha. Now, the Kenya Electricity Generating Company would have wished to be represented here today, but due to recent development in the organization, it was not possible to have representatives. Nonetheless, the forum deliberation shall be shared with KenGen as a key industrial stakeholder. I want also to recognize that some of the GAK board of directors are actually from KenGen, so they are actually represented in a different capacity. Ladies and gentlemen, the International Labour Organization estimates work-related accidents and illness lead to about 2 million fatalities per year. While this is disturbing in itself, it's likely that it's vastly underplays the extent of the situation. Many deaths and injuries aren't reported, while countries with the highest accident and illness rates are likely to be those with the best developed inspecting and reporting structures. The geothermal sector in Kenya is one of the sectors that employ thousands of people directly and indirectly. Geothermal energy also dominates Kenya power generation mix, which is largely renewable. Currently, geothermal contributes up to about 45% to the electricity generation mix as of June 2019, and is a key enabler of the government's Big Four agenda. Similarly, Kenya is the leader in the geothermal development in the region. As we may all know, professionals from the country have been offering their expertise in the region. KenGen, for example, has been offering contractor drilling services in Ethiopia and soon going to Djibouti. GDC, on the other hand, has offered training to regional scientists on resource development. Will all these positive steps undertaken both locally and regionally, geothermal operations exposes personnel involved to a variety of hazards that can lead to different types of accidents, which include and are not limited to slip, trip, fall, sprain, strain, contact with hazardous chemicals, stroke gases, etc. These accidents are known to cause fatal accidents and disabling injuries that can limit productivity of operations. Security challenges, sorry. Today's forum is the perfect platform to drive the discussion between the sector, stakeholders, and the government to discuss on the policies that have been put in place and deliberate potentially on how to improve on the policies. The policies should also be able to guide national organizations when venturing into new territories. Finally, the Geothermal Association of Kenya, being the umbrella body for the geothermal sector in the country, looks forward to working with the Ministry of Labor, Social Protection, and all stakeholders in developing or contributing to policies that govern occupational safety and health in the geothermal industry, so as to ensure that the sector records zero injuries, deaths, and attain maximum productivity. With these few remarks, I wish to welcome every participant to the forum as we deliberate on the policy discussion governing occupational safety and health in the geothermal sector in Kenya. I now wish to hand over the program to Dr. Gaduru Mburu, the Managing Director of KIPI Africa, who will be the moderator for the forum today. But as for on behalf of GAK, we want to say karibuni and let us learn and participate together. Thank you. Back to you, Dr. Gadulu.
Thank you. Thank you very much, sir, for that. It was really very important to hear from you on behalf of the Geothermal Association of Kenya. We are pleased that the association is standing strong with all its members through this COVID period and beyond. We now proceed with a presentation from the Directorate of Occupational Safety and Health. And representing the Directorate today is the Director, Dr. Andrew Muruka. And Dr. Andrew Muruka will now take over the screen and share his presentation. I request you, sir, to proceed. You're most welcome.
All right. Thank you very much, everyone, for this particular occasion. I want to record the utmost appreciation on behalf of the Directorate of Occupational Safety and Health Services to the organizers of this conference, and particularly to recognize the important role played by the Directorate in ensuring safe workplaces across the country. I will be talking about the current issues that is troubling the nation, and that is COVID-19. On 29th of June, the Directorate of Occupational Safety and Health Services issued a return to work advisory. And this was based on the fact that we were expecting an upsurge in the number of cases, particularly at the workplaces, as a result of the lifting of the travel restrictions that took place on the 7th of July, 2020. As we approach full reopening from all indications, we still have to look at COVID-19 as a serious workplace issue. And therefore, I will be able to look at this. At the beginning of this presentation, I'll be talking about what is really DOSH vision in terms of ensuring safety in the country. So our vision as a directorate is to be the best agency in ensuring safety and health in a safe work environment. We have a mission to promote a safe and healthy workplace by implementing effective systems for prevention of occupational diseases, cases of ill health, accidents, and damage to property, in order to reduce three things. Number one, compensation claims. Number two, the cost of production. And number three, to improve productivity in all sectors of economic activity. We have a mandate arising from the Executive Order number 1 of 2020. And our mandate is three-pronged. Number one is that we have a mandate to inspect all workplaces in the country to ensure that they comply with all laws relating to occupational safety and health. Currently, we have two laws, the Occupational Safety and Health Act of 2007 and the Work Injury Benefits Act of 2007. The second mandate is to promote occupational safety and health in workplaces and in the community. And surely this is what we are doing today. And number three is to ensure compensation for work-related injuries, which include actually occupational accidents, cases of illness, and cases of occupational diseases. I want to quickly look at our co-functions so that we are able to understand what within the space of the geothermal sector. Number one is to inspect workplaces to ensure that they comply with safety and health laws. And as I've said, there are two of those laws. The second co-function is to examine and test plants, particularly pressurized vessels and lifting equipment, which include boilers, chains, and other lifting equipment, including hoists, gas cylinders, and so on. We ensure this by doing it through appointment of competent persons to test these equipment on a regular basis and to ensure that they are safe and to issue certificates or of examination. Now, number 3 co-function is measurement of workplace pollutants to ensure control to appropriate levels. In this regard, we have officers in occupational hygiene division within the department that conduct workplace pollution measurements. In addition, we have approved air quality monitors to conduct air quality monitoring in workplaces in conjunction with occupational, with the different workplaces. The other co-function is investigation of occupational injuries, which include occupational diseases and accidents to prevent recurrence and to ensure that workplaces remain safe for workers. Co-function number 5 is medical examination of workers. And in this regard, we have a dedicated team of occupational physicians in the department. And we have also approved designated health practitioners across the country to conduct both pre-employment medical examinations, routine medical examinations, and also specialized medical examinations as may be required. Medical examinations for workers in hazardous work environments are required every 12 months. The other co-function is disseminate information, particularly in occupational safety and health. We disseminate this through various platforms. Directly, the Directorate conducts training in all aspects of occupational safety and health. We are also responsible for approval of training institutions, and we also engage other partners, including the media, to ensure that we are able to disseminate information that is relevant to occupational safety and health, and that is important for ensuring that workplaces are safe. So we conduct training as a co-function in all aspects of occupational safety and health, including fire, first aid, and also risk assessments. We have just recently launched risk assessment training at the Directorate, and soon we'll be offering approvals to those companies that are interested in conducting risk assessment training in industry to ensure that people understand this concept, apply it in ensuring that they are able to identify hazards and appropriate mitigation measures are put in place. Our co-function number 8 is approval of architectural plans of buildings intended to be used as workplaces. And this one we do directly. All county occupational safety and health officers are required to approve all the submitted architectural drawing plans of buildings that are intended to be used as workplaces. It's an offense under the Occupational Safety and Health Act to have to construct any building that is going to be used as a workplace without approval of the building plans. And the last function, co-function, is actually to compensate for occupational injuries. We have the policy to ensure that occupational injuries, including occupational accidents and occupational diseases, are compensated within the legally provided for timelines of 90 days. So having looked at the co-functions, I want to branch briefly to the COVID-19. Most of us are already aware that this was first identified on 31st December 2019 in China. It was officially identified and given a name, SARS-CoV-2, on 7th of January 2020, and was declared a public health emergency of international concern on 30th January 2020. On 11th of March, COVID-19 was declared a pandemic, and Kenya reported its first case on 13th March 2020. One of the things that used to be doubted before was that the virus was actually not transmitted by air. Just a few days ago, the US Centers for Diseases Control and Prevention has actually confirmed that COVID-19 can spread through the air. And Kadusi also has confirmed that COVID-19, there is evidence of airborne transmission. So I want to look at what really prompted us to issue the return to work advisory on occupational safety and health. One of the main things that we noticed that on the date of 7th of July, 2020, we were expecting that after the presidential decree lifting travel restrictions, there would be an upsurge in workplace activities. And this upside would be related to people moving from one place to another, including from areas with high risk areas to low risk areas, or from low risk to high risk, and then vice versa. So if we look at these cases as at now, around July, we started witnessing an increase in the number of cases of COVID-19. And although it has a low fatality rate, we have recorded very high number of cases. And of course, we have also recorded deaths. So on 7th of July, Kenya lifted travel restrictions. And if we recall, these restrictions were actually imposed when there was only a single case. These restrictions were imposed on travel from any country that had a single case. Of course, as we speak today, we have more than one case. And therefore, what it means is that COVID-19 is still with us. And therefore, we need to continue to observe these safety and health requirements to keep all workplaces safe in Kenya. So the goal of advisory was actually to ensure that all workers returning to work are safe and healthy. And secondly, to stop COVID-19 from finding a new local transmission epicenter and spreading in workplaces. These were the main reasons why we had to institute the issue of an advisory. So we have a few guidelines that I'm going to go through very quickly. And number one guideline is that occupational safety and health risk assessments is required to be conducted in all workplaces, on all workplaces. And the risks be quantified, and on a priority basis, action plans developed, focusing on the most significant risks. And these action plans are supposed to be submitted to the Director of Occupational Safety and Health Services for continued monitoring of the occupational safety and health COVID-19 risk situation in the country. The second guideline is on COVID-19 policies and workplace readiness. Every workplace is required to come up with a COVID-19 preparedness policy statement and ensure that the statement is shared with all workers. And this policy must be able to encompass things like occupational safety and health risk assessments, and in particular, prevention and mitigation measures against COVID-19. These are supposed to ensure that employees are aware of what to do, and the employer is sure of what to do in case of any situation that may arise at the workplace. Sorry, I'm experiencing some little, good. So guideline or advisory number 3 is on non-essential work and working from home. COVID-19 is still with us in the country. Technology has also enabled us to identify that it is possible for workers to operate from home. That's why we have issued this advisory so that workers and workplaces can be able to identify work activities that can be undertaken safely from home, and also identify the workers whose services can still be undertaken from home safely. And these are supposed to be documented, and specific protocols involving safe working from home be developed by employers to ensure that even those who work from home remain safe and healthy, and they remain also productive to the national economy. On the issue of commuting to work and safe passage to and from work, we recognize the systems of public transportation that we have in the country. And once the travel restrictions were lifted, we were hypothesizing that this will be another source of transmission. And this is why all employers are advised to sensitize their workers on every mitigation measures that have been developed, not only by the Ministry of Labor and Social Protection, but by the Ministry of Health, particularly in public places. So employers are required to consider safe commute to and from work if this is possible. However, if that is not possible, employers must be able to put in place measures to ensure that employees, their specific employees, have all the information that should be able to protect them from COVID-19 while in public or private transportation. And then I come to the issue of the advisory number 5 on workplace safety and health. These are the general requirements to be adopted. COVID-19 has actually brought in a new culture, a new safety and health culture that focuses on prevention and minimization of transmission of risk at the workplace. We must, as workplaces, therefore, adopt these new cultures. And one of them is the strict observance of the social distance, the wearing of masks, and regular sanitization or sanitizing or hand washing with approved sanitizers. We have advised in this advisory that no person who fails or refuses to use a face mask in any workplace, or fails or refuses to adhere to procedures or protocols established by the employer, should actually be denied access to that particular workplace. We have unfortunately received several complaints that there are people who are forcing themselves into workplaces. We must inform them that it is important for us to work as a community, as a Kenyan community, to work together towards the defeat of COVID-19. SARS-CoV-2, which causes COVID-19, can spread up to 9 meters. In fact, 2 meters suggestion social distance is just a very highly conservative guideline. Recently, just a few days ago, the International Journal of Environmental Research and Public Health has just published that the virus can go up to even 10 meters. And therefore, we need even distancing of up to 10 meters in some situations, particularly where there is some employees or some workers or in a gathering, there are no masks. The other advisory that we have developed and requested or required workplaces to comply with is the one on work injury insurance. And all workplaces, our occupiers or employers, are required to obtain and maintain a valid policy. And the insurer must be registered by the Insurance Regulatory Authority in respect of any liabilities that the employer might incur under the Work Injury Benefits Act. Occupational exposure to COVID-19 has been confirmed. Several countries have actually identified COVID-19 as an occupational disease. So in order to minimize the agony on either the employer or the employee, or accessing compensation when it is due, we have provided this advisory. This advisory is also in conformity with the Work Injury Benefits Act. Many people say that pandemics are not covered under the insurance policies. However, last week, we discussed this issue with the Association of Kenya Insurers, and they are in agreement that occupational diseases are all covered under the Work Injury Benefits Act. And therefore, all employers are required to ensure that they comply with this requirement in accordance with the existing statutes. The other advisory number 7 is on medical examination of workers and issuance of certificates of fitness. In this advisory, workers are required to to attend medical examinations conducted by any board-registered medical practitioner. And specifically, we are talking about doctors here. And once they have been identified, a certificate of fitness is supposed to be issued to all in accordance with the legal notice number 24 of 2005. Many people have asked whether we are saying that people must undergo COVID test. My answer is specifically no. We have left this at the discretion of the examining medical practitioner, who may request for such tests in case there are indications from the clinical examinations. And we have extended a legal notice to cover all registered medical practitioners or the medical doctors in the country, so that there is no question of congestion or backlog or something like that to prevent workers from accessing their workplaces. And of course, this is the example of a certificate of fitness that needs to be issued to every employee returning to work after 7th of July, 2020. Advisory number 8 focuses on health risk assessments for returning employees, and specifically, workplaces are required to determine any particular workplace substances or activities that poses significant risk to human health under these new circumstances. We know that COVID-19 is a respiratory disease, and therefore any respiratory any substance in the workplace that may have an effect on the respiratory system may exacerbate COVID-19 risk. And therefore those factors must be determined and their control measures implemented so that workers remain safe and healthy throughout this period. But COVID-19 has impacted heavily, particularly on mental health. One of the areas affected is actually people who have lost their jobs. In many cases, in some cases, some people have lost their jobs, both members of the breadwinners in the family. And this has led to serious mental health problems within the family. And in this regard, we have advised employers and employees to work together in a form of collaboration, communication, and in a way that ensures that if there is any employee who has or who has been affected by COVID-19 or SARS-CoV-2 virus in any particular way, then they can be linked to mental health support programs so that their mental health well-being is actually sustained. On the issue of suspected and confirmed COVID-19 cases for employees, we have advised, and this is in accordance with the Occupational Safety and Health Act, that any employee with a confirmed or suspected case should actually inform the employer immediately. And in turn, the employer is required to do two things. Number one is to report using -1 all cases of confirmed occupational COVID-19 cases to the Director of Occupational Safety and Health Services. The other requirement is to inform the Director of Occupational Safety and Health Services of all suspected cases. All these are required to be submitted using -1 form, which is the form that is used to report occupational diseases, accidents, and cases of illness. In case the cases or suspected cases of confirmed COVID-19 or suspected cases of COVID-19 are not work-related, then the data is required to be sent as it is in terms of statistics, in terms of numbers. And the employer shall require such employees who are suspected or have confirmed cases of COVID-19 to actually adhere to the relevant Ministry of Health protocols. Discrimination of employees, particularly those suspected to have any confirmed cases of COVID-19, we have advised that employees that face such kind of discrimination should report to the Director of Occupational Safety and Health Services in accordance with Section 8 of the Occupational Safety and Health Act. Therefore, appropriate action can be taken. Advisory number 12.
Sorry to interrupt you, just to kindly request, in view of the time, I really believe this is extremely pertinent information. We would be very, very pleased to share further the presentation, but sir, kindly, is it okay to summarize with a conclusion?
Yeah, I'm heading to the final slide actually. And workplaces are also required to register by duly filling in the required forms for registration. However, no workplace is required to register if they have a valid certificate, which is currently valid. The other requirement is safety and health audits, which should be titled Post-COVID-19 Initial Safety and Health Audit for every workplace with effect from 7th of July 2020. And these safety and health audits are required for all workplaces, regardless of whether they were closed or opened. And I would like to mention something on workers with pre-existing medical conditions, especially those who are aged 60 and above, and that employees aged 60 and above have over 80% case fatality rate for COVID-19. This has been confirmed in China, in Europe, and in the US, the actual case fatality rate is 95%. So they have a very high and elevated risk of dying from COVID-19. And finally, there is need for continuous monitoring of all these policy decisions that have been taken with respect to the advisory. And therefore, we request every workplace that may have specific interventions required that can benefit the whole country to bring those specific interventions to the attention of the director or the directorate for further decision making. I want to stop here, and And thank you very much for listening. Sorry I had to rush those 2 slides, but I hope everybody got the points that we were talking about. Thank you so much for listening, and God bless you.
Thank you so much, Director Muruka. That was an excellent presentation. Sorry we had to speed you up there in the end, but the gist of the matter is very clear. The policy for EACOSH is in place. The law is in place. The regulations and supporting guidelines also in view of COVID-19 are also in place. And these also have been adopted, as you will be hearing in a few minutes, by the geothermal industry, and maybe to some extent also beyond, because of the specific work nature of geothermal exploration, production, and power generation. Asante sana, Dr. Muruka. We are eternally grateful to you. At this juncture, I would like us to proceed, and we will be having now a presentation from the Managing Director and Chief Executive Officer of the Geothermal Development Company, Bwana Engineer Jared Otieno. We will have this presentation delivered on his behalf by Bwana Paul Goge, and I've been informed that our MD and CEO will be joining us as we proceed. So at this juncture, I would like to welcome Bwana Paul Goge to make the presentation on behalf of Engineer Jared Otieno. Bwana Paul Goge, please proceed. Thank you.
Dr. The moderator, can you hear me?
Yes, we can hear you very clearly. Karibu.
Can I also be allowed to share the presentation, please?
Yes. One moment. You should have the function share screen and proceed and share the screen.
It's still disabled, but maybe even as we start, I just want to, first of all, to regrettably say that our CEO is still tied, and considering that he has been on the forefront leading the team and the company in managing COVID, I think that is very regrettable. I hope everybody can be able to see the screen.
Yes, sir. We see it very well.
Can you confirm?
I can confirm. It's very clear.
Yes, I do not want to repeat what Daktari has said, so I will probably, and especially being an operator, I'll probably say the things that have been of great challenge to us. The first thing that COVID has done, it has had unique challenges, especially for everybody who is an operator. The first thing is that we've had a disease, and the disease is not very well known. We actually are learning to manage. We are learning to manage the same as we learn about it. And obviously, it means that some of the management mitigation measures put in place have had to lag behind sometimes known issues. The other aspect that is of great challenge, I think, to any operator is the fact that we are actually infecting one another. So, especially the nature of our business, it means that we have to have teams, and those teams, obviously, when there is cross infection, one from the another, then obviously that becomes a great concern. Thirdly, the other concern is obviously that as we speak now, the world together has recorded over 1 million deaths. And obviously that creates great fear. And considering that infection is coming from colleagues, then obviously great suspicion then arises in that environment. Obviously, as an employer's representative, the other aspect is that you want to remain operational even in such situations, and interruption of operations, and in particular having to adjust to new norms, then become a challenge. So I must therefore commend the National Emergency Response Committee, who have been for us a great insight and also a source of information, which has helped us to be able to manage so far. The other aspect is that management of COVID has had to depend a lot also on the social behavior of personnel, and obedience also, and their willingness. So obviously, considering that we have had to put the mechanisms in place to ensure that our staff are safe, certain aspects of welfare also is affected, And obviously, certain environments, even the kind of mitigation measures that are put forward probably have no place. I have examples like when you send people into the bush and they have to work there, and you are supposed to provide especially water for washing their hands as frequent as possible. And obviously that then becomes a challenge. The other aspect, of course, we work as teams, especially because to a great extent, some of our work are manual. And considering that we are supposed to keep social distance, then that also becomes a fair challenge. The other aspect that has also been of great challenge is the workplace. The workplace is, and especially the current, or rather before the new norm, you will notice that interaction within the workplace is one of the common aspects. And considering that we are supposed to keep social distance, obviously that puts a lot of a challenge. Again, common places such as laboratories and lifts obviously become difficult areas to be able to manage. Certain areas of social welfare, such as providing of water, especially in the form of dispensers, suddenly become areas of great risk. And as a company, then we have had again to be able to change the way we actually are providing social welfare. In certain situations, especially on a 24-hour operations like we do, when situations that we try to limit or try to find ways of providing food safely, and the staff are staying in barracks, so they share barracks, they have to sit in the same place to have food, and of course go to the same workplaces as teams. While again trying to keep social distance, that has become quite a bit of a challenge. So even putting infrastructure in place to support working at home has also been issues. When you have manual workers and you need to keep distance, and some of them must leave the workplace, obviously then you start finding that when they are manual workers at home, then they are not able to provide the necessary services to justify their employment. And even situations where workers have had to work at home, there are infrastructures like having to now provide even laptops to enable the staff work at home, then that becomes a challenge, and even how to track their performance. Obviously, adaptation has become one of our most important aspects. How do we adapt in that environment, especially considering that we have had various guidelines coming from different agencies, and domesticating the same also within the company, so that we are able to put mechanisms that we can be able to manage within the company, and also being able to communicate the same to the staff, so that you can actually kind of direct common behavior. That obviously has been a lot of challenges. As a government entity, procurement obviously becomes another challenge, because you may not have all the speed that you may require to actually be able to procure what you need. But GDC management has ensured that all above updates are timely shared with its workforce in its weekly updates. The other aspect of the pandemic, and especially because of the way it has affected us, is the restriction of movement. We operate a 24-hour operation, and we have staff staying in barracks. And obviously, there is a lot of support services that are required. So when the pandemic came and we had restriction of movement, obviously now that affects operations. We have a workforce of roughly about 500 people in the field. And when we now could not be able to transport them beyond certain hours, yet they are supposed to support operations, obviously that became a bit of a challenge for us. And one of the things that we have had to do is to sometimes have to get the police, public health, and county governments to work with us so that we can be able to manage our situation, as well as be able to ensure that service provision continues. How has COVID impacted us? The first thing, obviously, is delayed deliveries and procured goods and services. There are a lot of things that we were expecting, and that has had impact. Obviously, the other aspect, which is not written on the screen, is our relationship with our service providers. On the one hand, many people do come to the company to follow up on payments and deliver invoices. And as soon as the COVID was declared, we put restrictions on who can get into the building. And obviously that has affected our relationship with some of our service providers. The other aspect is increased staff overtime costs. There are situations in certain areas where the community, the host community, felt that we as a company, and especially our people, because of having to come from different places, were exposing the community. And obviously what now was agreed is that the staff had to work longer, and obviously that meant that they were going to be on overtime because they were working beyond their required hours. The other aspect is that some of our major Vision 2030 projects have been impacted. And this is because with the restriction of movement internationally, so experts could not be able to come on time. Obviously, with the issues of even ships having challenges going places, and also industries shutting down abroad, has affected even one of our major projects. This, of course, has brought a slowed pace and downtime in geothermal wells drilling. Deployment of staff and undertaking drilling then becomes a challenge. And obviously keeping everybody trying to move safely, that has also become a challenge. Of course, the other challenges is in contract implementation. Some of the areas that we have committed to do becomes a challenge. Also obligations of others to us, that has also become a challenge. And obviously now delays in conclusion of projects, contracts, and implementation. There are situations where even contractors had to shut down completely and essentially wait until we are able to have the situation improve. And as I had already indicated, that because some of our staff now were supposed to work from home, we didn't have sufficient infrastructure to ensure that they perform properly. So when, as part of managing social distance, some of the staff who went home, we could not be able to have them give us sufficient output as required. One other additional issue is additional budgets. COVID-19 came almost mid-year, and we did not anticipate this, and it was not in the budgets. And obviously that has put a lot of strain on the available resources. How have we then been able to respond? The first thing that we did, and this is why probably I missed the CEO doing this presentation, is that he quickly formed a corporate response committee, and also that is at the head office in Nairobi. And also we formed corporate regional committees. Essentially, the regional committees were to really look at the status of how we are affected, and also to look at the trends within internationally, locally, and even regionally. Obviously, also to look at areas where we were most exposed, and finally, to be able to put management mechanisms to ensure that we keep the workplace as safe as possible. The other aspect which we did, and our CEO again was on the lead, was the fact that we then approached the Ministry of Health and the county governments. And these two have helped us in terms of voluntary testing. And that has given us an understanding at least of how prevalent the problem was with us. Fortunately, we can say that we were not greatly affected, but we were not having very many cases, but we were obviously affected in different ways. Thirdly, the other aspect is counseling and psychosocial support for our staff. We had a few cases, about 10, who turned positive. And obviously, any case that turned positive also made the rest of the staff very fearful. And we therefore had to not only take care of the people who are turned positive across the primary contacts, but also we had to look at the greater workforce in terms of ensuring that they do not stigmatize those who turn positive, and also to be able to encourage them to be able to accept to work or to admit back those who are positive. So these are some of the challenges that we have. That's just a pictorial. You can see the first picture on the very top left. That is our CEO undergoing the first test. And on the same line at the top right, you find the regional manager, Central Rift, also leading the team in voluntary testing. Besides that, also, other issues that we have put in place is the installation of hand washing and sanitation stations at all entry points, regular cleaning, fumigation, and disinfection of premises. The other aspect is implementation of shift rotas for office staff to reduce overcrowding. One good thing is that probably previously we used to travel a lot to meet, but we have adopted Teams and Zooms as the new norm in terms of meeting, including this meeting. So that's a new positive aspect. And then adjusting seating arrangements to increase spacing and putting barriers for receptionists so that we could minimize physical contact. At all our entry points, body temperatures for all entering workplaces is done. Again, provision of PPEs. As a company, we made a decision that we'll provide masks, and in certain situations, we have provided the hand gloves. And also, we have minimized the offering of tea in the workplaces, and also water stations, so that we could reduce areas of infection. As a mitigation measure, also, we recognize that we could not be able to succeed without having the employment or the employees come along with us. And from the very beginning, we actually adopted a way of disseminating the guidelines that we receive from various sources through various methods, and through obviously the committees, and also through memos. and also through sensitization platforms, so that we can carry our staff along, because without them, we could not be able to succeed to manage the situation within GDC. In addition to that, then we have had to ensure that all our sanitizers are always equipped, and water is provided where possible. And more importantly, we have provided under our medical scheme to ensure that those who are sick then can actually be able to get services as required. As a company, we therefore continue integrating COVID-19 mitigation measures in all its operations to ensure continuity and the safety of its workforce in all places of workplaces in the project and operational areas. More importantly, we keep on monitoring the situations so that we can be able not only to help, to keep the workplaces safe, but to also encourage those who may have become infected, so that they feel they are part of the family. I think with that, I want to say thank you for this opportunity. Thank you very much. Back to you, moderator.
Thank you. Thank you very much for that, Mr. Paul Goge. It was very clear. There are quite a number of steps that the geothermal sector, and in specific, the Geothermal Development Company, has taken. There is mitigation in the operations. There is finance, which has come under a lot of strain. But also importantly, you've mentioned the stigmatization of the workforce and the steps that you have taken, so that we are not in a position where there is any embarrassment, any stress being developed because people have tested positive. I think we need to realize that this is something that nobody anticipated, that it can affect any one of us, and that we need to take the measures, as you've clearly shown us, so that we're able to reduce the numbers and indeed support our colleagues in the geothermal sector who've been affected both directly and indirectly. Ladies and gentlemen, I am very pleased to say once again, thank you to Bwana Paul Goge for that presentation from GDC. Remember that the theme is investing in occupational safety and health in the face of COVID-19 for a sustainable geothermal industry. In this regard, this partnership between Kipia Africa and the Geothermal Association of Kenya is really focusing on the people side, the labor side, and the geothermal side. And in this regard, I'm very pleased that we have been joined by the Principal Secretary for Labor, Honorable Engineer Peter Tum, who will be delivering the keynote address in 10 minutes. Just before we have the address from our Principal Secretary, I would like to invite a private sector player, but fully well known in the geothermal space, Dr. Stephen Onacha, to give us some of his perspectives in respect of the discussion we're having today. And in particular, I have a question for him. Daktari, karibu sana. Please feel free to unmute your microphone so that we may be able to hear you clearly. Daktari, what are some of the key safety and health concerns faced by the independent power producers in Kenya, specifically yourself from Akira Geothermal, and in regards to COVID-19, how are the IPPs handling this situation. Karibu sana daktari.
Thank you very much for the invitation and the kind introduction. I will talk very briefly about the safety issues and health issues from private sector. I think the health issues in terms of management tend to be not the major ones, because you can put in place a very good management system and train your people to handle some of this to minimize the risks. And this is by private sector because you are required to plan your project from the end to the beginning, which means that the financing institutions and equity providers would like you to have all your documentations up to the end of the project, including the debt financing. So those will kind of have to interact with a lot with safety issues of the international standards. And sometimes there's a conflict between the international standards and the local standards, which needs to be harmonized. So that's probably an issue on policy that will need to be discussed. In terms of the health issues, probably, I said before, they are minor. They'll be associated with each stage of development, including when you are doing construction works and interaction with the works that are going on, for instance, dust issues, which lead to breathing problems, but those can be managed with a proper management plan. I will dwell a little bit on the safety issues and look at the issues probably that are not documented within the documents we've provided. Some of those safety issues arise from land access issues by private sector. So in terms of land access, you are faced with the very big issue of managing stakeholders. And sometimes you don't know who are the stakeholders. And this can be a safety issue because the demands of the competing groups can really be a problem. Another safety issue that might come from that is the community themselves fighting about access to the resources associated with the development. So that becomes a big problem in terms of how you manage the stakeholders, sometimes not knowing who is defined as stakeholder. The other issue that I've already mentioned is that because of the obligations of financing internationally, sometimes there's conflict between the local standards, international standards, and what is the reality on the ground. So that becomes a conflict in terms of safety for everybody because of the expectations from the standards. I think for private sector, in terms of management of the resources at the moment, of course, international travel has greatly affected how we function, the limitations on the travel itself, and this has been a problem. So as it has been highlighted, this has been managed through Zoom and Teams, but you need site visit to confirm certain issues on terms of the project itself. One of the other issues that is related to safety in terms of land access is probably what many people know as encroachment or illegal settlements. In terms of this restricted travel, some people have taken advantage, sometimes to encroach illegally, and this becomes an issue for the private developers. I think if there are other questions, I would like maybe at the question time we'll answer, but that's all my contribution to this topic.
Thank you very much, sir. I would like to certainly say that from this platform, the EACOSH, we are very grateful for your participation. We have taken key note as a private sector player. Land access has been an issue. What standard to follow also has been an issue. But also this platform we are using, Zoom, has provided a mitigation in terms of virtual meetings, but there's also a need to be physically on the ground interacting. At this juncture, Bwana Onyancha, I would like to request you to stay with us as we also request Dr. Muruka from DOSH to participate in this upcoming panel discussion. Before we get there, we have with us, once again, the Principal Secretary for Labor, Engineer Peter Tum, whom we would like to go to now so that we allow him to deliver the keynote address on behalf of our Cabinet Secretary, Honorable Simon Chelugui. Sir, welcome. It is a pleasure to have you with us. I want to invite you now to switch on your video, to unmute your microphone, and we will allow you then to proceed. Welcome, our Principal Secretary. As we wait for our Principal Secretary to situate, I will request Dr. Muruka to take one of our panel questions. Please feel free, all of you, to send your questions directly in the panel. So, Dr. Muruka, as we allow our Principal Secretary to situate, I will ask you a question, Dr. Muruka. Kenya is a leading and growing geothermal powerhouse. Has the time come for the geothermal industry to have specific OSH regulations? And what would be the impetus for these specific regulations? And what would be the steps to the enactment of such regulations? Dr. Muruka, please feel free to unmute your microphone and proceed. Welcome.
Thank you, Dr. Gaduru. I think in terms of the status of occupational safety and health in Kenya, and particularly with respect to industry-specific regulations, I would like to say that there is very high impetus at the moment for specific regulation in this sector. And one of the driving factors is the high risks associated with this sector, which have potential to cause bodily injury to workers, including death. So that's a very important aspect that needs to be looked at when we are looking at regulations. The second reason is that this sector is on an upward trajectory. There is a rapid growth. We have seen major investments in geothermal sector in the Rift Valley, the Rift Valley area. Thirdly, there is a high demand for electricity. And this one is driving expansion of activities, exploration activities, drilling activities within the country. All these require specific engagement with the legislative agendas. Then number 4 is that we have provisions for enabling legislation. If we look at the Occupational Safety and Health Act, section 127, subsection 4, it gives the minister power to make regulations for specific sectors or economic activities of the economy or in the country. So there is enabling legislative provisions to provide for that specific regulation. And finally, when we look at new explorations and new discoveries of geothermal resources, it also angles very closely and reminds us that we need to have specific regulations in this particular sector. This particular sector is unique in simple terms, and therefore that is why we need some kind of specific regulations to address those uniqueness so that it is not lumped together with other sectors in the country. So I think those are the driving forces. But now you have asked another question, which is very interesting. What are the steps that we need to undertake, for example, to go towards and achieve a specific regulation? Of course, I will start with the end. The last activity that we need to undertake is actually the gazettement of regulations. But now, how do we go about it? Number one, we must be able to have a task force or a technical committee that should be able to review existing laws and regulations. And identify
Bwana Didi, have I been unmuted?
Welcome to our Principal Secretary for Labor, Engineer Peter Tum. Sir, your officer was just concluding a question. Kindly allow him to conclude, and then we will come to the keynote. Back to you, Dr. Muruka. Thank you.
Thank you. Allow me to recognize the presence of the Principal Secretary, State Department for Labor, Engineer Tum. Thank you, sir. I was addressing the issue of what are the steps to enact specific industry-specific regulations for the geothermal sector. And I was already on step number 3, and that's the need to develop a policy paper specifically addressing health and safety in the geothermal sector. Then there is need to come up with a consultant who will be able to assist in the drafting of the safety and health regulations. And finally, once the draft regulations have been drafted, they need to be presented before high-level workshop of stakeholders. And after that, once the workshop approves the regulations, then the minister can gazette them so that we are able to have these regulations. With respect to timelines, of course, that depends on funding and the appropriate scheduling and the appropriate participation of the key stakeholders.
Thank you, Dr. Muruka. That was an excellent presentation on the steps that the geothermal needs to take in view or in the desire to have occupational safety and health specific industry regulations.
Yes.
Without further ado, on behalf of Kipia Africa, in collaboration with the Geothermal Association of Kenya, and all the geothermal and occupational safety and health practitioners with us today, both from the public sector and the private sector, it gives me great pleasure to welcome, on behalf of our Cabinet Secretary, Honorable Simon Chelugui, the Principal Secretary for Labor, Honorable Engineer Peter Tum, to deliver the keynote address by the Ministry of Labor and Social Protection. Welcome, sir.
Thank you very much, Dr. Ari. Ladies and gentlemen, good morning.
Good morning, sir.
First and foremost, I would wish to apologize for the letdown by technology, which, as I was trying to control from my end, I realized that somebody else had to do the same that I might not be able to locate as at the moment. But I want to say thank you very much, whoever is doing the control, for having given me this opportunity to be able to address this meeting. Chair, I don't know, or the moderator, I don't know whether I'm loud and clear. Please signal me if I am, so that I can proceed.
Sir, I see that you have a certificate in the use of Zoom. You are loud and clear.
So thank you very much, Chair, Geothermal Association of Kenya, my friend and former schoolmate, Engineer Abel Rotich, whom I cannot see. The CEO, Kengen, Mrs. Rebecca Miano, Geothermal Development Company, Engineer Jared Otieno, CEO, Kipia, Africa, Dr. Gasharu Mburu, Secretary, Directorate of Occupational Safety and Health, Dr. Nyandusi, Ministry staff, distinguished participants, ladies and gentlemen. Let me take this opportunity to thank you very sincerely for welcoming me to give a keynote address on behalf of my Cabinet Secretary, Honorable Simon Chelogui, who would have wished to be with us this morning, but because of other exigencies, he has kindly requested that I give his keynote address on his behalf. And before I read his keynote address, let me recognize the fact that I am addressing most of you who could be friends because of the other life we were together. Like I said, Engineer Abel Rotich was my schoolmate and my senior. And it was very, very important that I joined this meeting, whether I was going to read the keynote address or not. I had wanted to be with you today. And secondly, it is because of the issues that you are addressing, and the issues that you are addressing speak loudly to what is the Ministry of Labor and Social Protection, where we know that energy is a key driver of economic growth in this country. And we know very well that even as the energy sector is doing its best to employ, that spurring of the economy that your product is doing is also, expanding our intake of those that we generate or that we qualify from our tertiary institutions, which, as we are all aware, we are employing around 800,000 of those who qualify every year. However, even as we go along discussing geothermal and everything else, we should all collectively be looking at a way of ensuring that the rest, the 400,000 graduates from our tertiary colleges and middle-level colleges get some sort of employment. Meaning, therefore, then that energy as a driver of economic growth is a sector that we all must focus on. So as I introduced, I'm going to read the keynote address that was left to me by the Cabinet Secretary in charge of Labor and Social Protection, Honorable Chelogui. And I read, I am pleased to join you all in this meeting on occupational safety and health in the workplaces, especially in the geothermal sector. This event comes on the backdrop of a report that my ministry released last month on the skills profiles in the energy sector in Kenya, which was done as part of the ministry mandate of regularly conducting skills needs assessment in various sectors of our economy. Ladies and gentlemen, the importance of energy for social and economic development, access to clean, affordable, and reliable energy has been adopted as one of the United Nations Sustainable Development Goals that all countries aim to achieve. Locally, the Kenya Vision 2030, as well as the Big Four agenda, identifies energy as one of the infrastructure enablers of its socio-economic pillar, since it has productive interlinkages with the socio-economic activities such as manufacturing, service, agriculture, and commerce, among others. We appreciate that geothermal is a key source of electrical power in Kenya, currently contributing to around 44.63% of the electricity generation mix. As policymakers, my appeal to you all is to appraise yourself with the findings of the survey so that the implementation of the recommendations can begin. Specifically, the survey questionnaires were administered to enterprises within the energy sector covering both upstream, that is exploration, and midstream, that is refinery, storage, and transmission, covering enterprises mainly involved in fossil energy extraction, that is oil, gas, and coal, electricity generation and transmission, that is hydro, as well as energy exploration, that is coal, oil, wind, geothermal, and solar. The survey sought to establish employment dynamics and skills demanded in the energy sector, as well as establish if there existed skill gaps or skill mismatch, whether there were any gender imbalances, and also to determine immediate and future skills requirements for this sector. The survey established that the subsector with the highest number of employees was energy generation, followed by transportation and then transmission. While skill area that was most predominant in energy sector was electrical engineering technology, followed by business and administration. Similarly, it was found out that the majority of establishments preferred future workers to have diploma and artisan skill levels training, with very few requiring employees with degree level training. It was also established that the preferred future skills was predominantly in the engineering and engineering trades, physical sciences, and business and administration field of study. Unfortunately, it was found that on the overall, male employees constituted 75% of all employees, and there existed a very high number of non-technical employees in the entire sector, which may eventually affect the overall sector performance. From the findings of the report, we recommend as follows. 1, linkages between industry and training institutions be strengthened in order to review curriculum to accommodate emerging occupations. 3, secondly, affirmative action should be taken to encourage female students to venture into technical related trainings through scholarships so as to reduce gender disparity in the energy sector. Thirdly, the proportion of employees doing non-technical duties in the sector was much higher than would have been expected, and many needed to be addressed. Lastly, with the changes in technology, it is evident that there are changes in the skills requirements within existing occupations, which therefore necessitate the need for training and skills upgrading. The above are thought-provoking findings, which can form part of discussions in this and other fora for stakeholders in the energy sector. Now, ladies and gentlemen, the geothermal sector is projected to continue growing. And with a good number of workers in the sector being in technical departments, enhancement of occupational safety and health for the workers is vital during the current pandemic and beyond. It is noteworthy that workers in the technical departments in the industry are the most vulnerable to hazards due to the nature of their roles and responsibilities, since several of the activities fall in the category of high-risk activities, such as working in confined spaces, probably working in tunnels or underground, places, working at high levels from the ground, working in remote areas, some which with additional security risks to employees. We know there are drilling activities. We know that there are times when the workers are put to work in awkward postures, repetitive work activities, or static work activities and working in extreme weather conditions, among others. Because of the increased risks to employee safety in the geothermal sector, employers need to invest in occupational safety and health, not only as a loss control measure, but also as an economic, legal, and moral responsibility. Effective and efficient risk mitigation and management in the sector is critical to long-term sustainable development of the geothermal sector. And with the number of workers projected to continue growing in this sector, there is need to have sufficient occupational safety and health systems in place that will keep these workers safe and assure them of safety as they continue working. My ministry, through the Department of Occupational Safety and Health, continues being ready to offer help to all organizations to comply with the EACOSH requirements, not as a policy body, but a facilitative body for the betterment of all workers, and will be available to advise on evaluation and control of risks along the geothermal value chain for exploration, drilling, production, steam gathering to power production. Since all these processes may expose workers to different responsibility there for them, that we work very closely with EACOSH so that we minimize the risks to everyone else. It is also important to note that the cost of preventing accidents from happening is insignificant compared to the cost of compensating a worker. For this reason, proactive measures need to be adopted in the geothermal project site to reduce accidents and injuries. The industry needs to identify control measures to minimize both fatal and serious injury. And since all persons are at equal risk of encountering any type of accidents, this therefore calls for consistent compliance to safety requirements by everyone in that sector. Ladies and gentlemen, it is important that proper training is done to make sure that all staff can identify task-related hazards and be in a position to take corrective action. Similarly, workers would be provided with workplace tools and equipment that are sound and safe to control hazardous forms of energy. Before I conclude, let me say that last month I held a high-level meeting to explore ways of reforming the work injury benefit scheme. And our proposal is to move away from the blame-based approach to a social injury insurance-based system. Because when accidents happen in the industry, those injured should be compensated without either the injured or the company being made to feel like the culprit. We are still engaging on this and will soon be consulting all industry players in due course. Similarly, through a public and stakeholder engagement, my office has developed an occupational safety and health, oil and gas regulations. These regulations will soon be gazetted to provide the best hope for sustainable exploitation of oil or exploration of oil and gas resources in the oil and gas sector. I appeal to stakeholders in the geothermal sector and in particular members of the Geothermal Association of Kenya, that is GAC, to initiate discussions on proposals to develop an occupational safety and health regulatory framework that recognizes the uniqueness of the activities that are carried in the geothermal sector. Specifically, consideration should be put a lot of emphasis on sustainable, employer-based, and employee-centered risk management. Distinguished participants, with the reopening of our economy, my appeal is that the geothermal industry will continue to fully implement protocols as guided by WHO, the Ministry of Health, and the ministry through DOSH, which include hand washing campaign, provision and use of PPEs and masks, temperature checks, maintaining social distancing, and sanitizing workplace surfaces. As I conclude, because now I need to conclude, let me take this opportunity once again to state that my ministry will continue to work with all stakeholders in the geothermal sector to ensure that geothermal operations remain safe and that workers remain healthy, since healthy workers are the backbone of economic development. Thank you all for taking time to participate in this meeting and for giving me an opportunity, my thoughts with you. Thank you and God bless you. Asante sana.
Thank you. Thank you, sir. We have taken keen note that you have very good familiarity with the geothermal sector, with the energy sector in general. And indeed, your colleagues are all very appreciative. They are actually within this webinar and they're happy and very pleased to see you. I just take key note of the energy sector labor survey, key findings, partnership with industry and training. That's number one. Number two, female participation. Number three, technical career focus. And lastly, training and skills development. Thank you very much, sir, for that delivery of the keynote address. At this juncture, I would like to welcome the Executive Officer of the Geothermal Association of Kenya to deliver the vote of thanks. Welcome, Mike Waweru Karanja. Karibu sana.
It was nice to meet you.
Mike, please feel free to unmute and proceed.
Okay, thank you so much, Bwana Moderator, and thank you so much, Bwana PS, Engineer Peter Tum, for the keynote address, which is very well received by the stakeholders of the geothermal sector. Allow me at this juncture just to give the vote of thanks on behalf of the Geothermal Association of Kenya and also on behalf of KIPIA, who were the collaborators in this forum. So to begin with, we would like to thank you, Bwana PS, for having had time to come to this forum to deliver the keynote address on behalf of the Cabinet Secretary, Ministry of Labor and Social Protection. Categorically, it is very good to note that you are a schoolmate of our chairman of the Geothermal Association of Kenya. We will gladly mention that to him, and we will also mention that you are very glad to participate in this forum. So thank you so much, Bwana PS, for having had time to come and delivering the keynote address. I would also want to pass the regards to Bwana Paul Ngugi, who delivered the presentation on behalf of the Managing Director and Chief Executive Officer of the Geothermal Development Company. So thank you so much, Bwana Paul Ngugi. We'd also want to say a big thank you to Dr. Andrew Muruka, who was standing in also for Dr. Musa Nyandusi, the Secretary of Occupational Safety and Health under the Ministry of Labor. Thank you so much, Bwana Andrew Muruka. We highly appreciate your support from the DOSH department. We'd also want to thank the Director, Geothermal Resource Development, Akira Geothermal Limited, Dr. Stephen Onacha. Thank you so much for stepping in. We highly appreciate your perspective from the independent power producers. That was highly appreciated. Even the statement about security and land access. I think this forum has really created the platform for us to begin the conversation on how to go about some of these things, and also to note the discussions made by Bwana Andrew Muruka on the steps to follow. So thank you so much for that. We'd also want to appreciate the members of the board of directors of GAK who are present here with us. I take note of the presence of Peketsa Mangi, who is part of our team who helped us put this together. Thank you so much, Bwana Peketsa Mangi. Cyrus Karingithi, the GAK secretary, who is also here. I also note the presence of Frederick Apollo, a GAK board of director member, and Gabriel Wetangula. Thank you so much for having had time to participate in the forum. Managing Director, Kipia Africa, Dr. Gadhuru Mboro, we have spent a lot of hours working on this forum, and it is glad to see how it has turned out to be. Thank you so much to you and your team, all members of the Geothermal Association of Kenya. All of you who have had time to come to this forum, we want to thank you so much. I hope it has been of great benefit to all of you, and we look forward to having more forums like this. And all distinguished ladies and gentlemen from other sectors, we thank you so much for having had time to participate in this meeting. I want to I think hand over back to the moderator, Dr. Gadhuru Mboro, who will take it over from here, and he will guide us on the way forward. I think we have very important take-home points, especially in terms of developing the EACOSH legal framework specific to the geothermal sector. I think the industry is really in need of such a policy document. And as a Geothermal Association of Kenya, we want to state that we are ready to work with the sector in terms of the development of this legal framework. So thank you so much to everybody. I hand it over back to Dr. Gadhuru Mboro. Thank you.
Thank you, geologist Mike Karanja. It is a real pleasure for me and my team at Kipia Africa to be part of this conversation. We have received a lot of questions via the chat feature that we will want to address. However, we are cognizant of the time. And in this respect, we request that those questions be addressed via email. So all your questions will be addressed via email. We would also like to request that all of you send in your feedback about this forum. You will see it in the chat right now on your screen. In the chat box, there is a link to a feedback form. It will take you less than a minute to send that feedback, but it will assist us to better understand your needs. And in conjunction with the Ministry of Labor and Social Protection and the Directorate of Occupational Safety and Health Services, we will be able to guide you accordingly. From us at Kipia Africa, it's a very big thank you to the Geothermal Association of Kenya for working with us to enable this platform during this period of the pandemic. Asanteni sana, God bless you, and we look forward to the next session with you on the EACOSH, where we will be discussing the technology platform. Have a good day, be blessed, and kwaheri.